Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day. Hey, sorry, I'm looking for Nicky, Cartwright.
She should be on the unit if they're checking.
In the bay?
Yeah.
Oh, right, fab, thanks.
Just moving you back about 2 points.
Hello, you alright?
Hi, I'm Nicky Cartwright. I'm currently Band 7 Practice Educator on Horsley ICU.
And so we're standing in the bay. Why do we have such a big room?
Because you need to have quite a lot of space in between each patient, because you've got a lot of equipment.
Yeah.
You've got your ventilator, your life support machines. That takes up quite a lot of room. You know, and then on the other side, you've got your pumps, all your infusions.
So there's a lot of equipment
There's
around
a lot
the bed.
of equipment, yeah. So, and also it's got to be a certain space as well between patient to patient.
I just think it's such a unique setup because
It is
everybody's
actually,
sort
yeah.
of facing everybody.
Yeah.
From this nurse's station
Yeah.
here behind us,
Yeah.
you can see
Yeah.
pretty much every
You
single
can, yeah,
patient.
yeah.
Is there a benefit to doing it like this?
Well, yeah, because these patients are critically ill. If a nurse is in trouble, they can just shout for help. Somebody's there straight away. When you're more experienced, you pick up on these things. You can just look around and you can see that,
Yeah.
you know, or they're struggling a little bit. And
Yeah.
you'll go over and you say, oh, do you need any help?
Almost like that sixth sense.
Yeah,
Because you've been here long enough to...
Yeah.
How long have you been working in ICU?
So it'll be 18 years this
18?
year. Yeah, a long time.
So you must have seen it change quite a lot.
Big changes. So when I started in 2008, so we just had 10 bedded units. So there's 9 beds in this main bay, and then we've got a side room, and then we did have an extra room actually where the officers are now.
Right,
So
okay.
that used to be another room as well.
Gosh.
And then we had HDU still. That's not changed much. So we've got a corridor which has got 6 side rooms.
So
on the
those are
corridor.
just individual beds in each room,
Yeah.
aren't
So,
they? There?
for example, if a patient has an infection, or sadly if they're end of life, they'll move them into a side room.
Okay.
Or if they're getting transferred from another hospital as
Okay.
well, like being in another hospital,
Yeah.
we always tend to put them in a side
Yeah.
room.
So traditionally they'll start in the bay though, will
Yeah.
they? And then depending on how they proceed, they might need more specialist one-to-one in a side room.
Yeah, well, no, this is still the same as the side
Okay.
room. You've got one-to-one nursing. Sometimes they're level 3s, you know, they need a lot more support. Like the man just sitting there in the chair, he's a level 2. He's not needing as much support. So you could have 2 patients like that to 1 nurse.
Right.
But the patients on ventilators with either a tracheostomy or the endotracheal tube, the one that goes into the mouth,
Okay.
they're one-to-one nursing.
Because that needs a lot of focus
It
to
does,
make sure nothing goes wrong with that
you've got
patient.
you've got to make sure the patient's safe because you're looking after that tube.
Yeah.
That's where they're getting their oxygen. You don't
Yeah.
want anything to go wrong.
Obviously, like you said, there's some very, very ill patients in ICU. What kind of things are people coming into the unit with?
Quite a variety. So you might get somebody that's coming in that's had a subarachnoid hemorrhage.
So that's a big bleed on the brain.
Yeah, that's a bleed on the brain. You can get people that have had a traumatic brain injury, whether they fell down the stairs, car accidents, people that get assaulted as well. And then you've got your spinal patients as well. I remember looking after a lady, she was just jumping up and down a trampoline with her children, and then she ended up having quite a high C-spine injury.
So
and
a
then she
broke her
couldn't-
neck,
She broke
essentially.
her neck, yeah.
Gosh.
It's quite traumatic.
Yeah.
So the nurses on here, you know, they've got to deal with not just looking after somebody that's like critically ill, they're also supporting the families as well.
Yeah.
And you're on shift for like 13 and a half hours in total, and it can be like extreme emotions. It is
Yeah.
quite draining. On one occasion, I was looking after this lady, she had a subarachnoid hemorrhage. She was also pregnant as well.
Gosh.
I remember having a student working with me as well. And we looked after this lady for 3 long days. She was really quite poorly. She was on a ventilator. She was sedated. The issues there, so I had to go to lots of meetings
Yeah.
because at that point the pregnancy wasn't viable, even though she was only like a few days maybe a week from it being viable, the pregnancy. So we had to go to lots of meetings. We had to have a gynaecologist. I think it was a gynaecologist that come in. And then, they were scanning the baby every day. And you'd see the baby move. A poor husband was, having to deal with, he was sitting there watching all this go on, hoping that she'd pull through. And then she became very unwell. Basically, there was nothing that we could do. We tried everything. And then, unfortunately, she passed away. So it's very emotive. Cases stay with you. It's not something that you forget, or it's not a job that when you go home, switch off.
Shut the door and...
Yeah, because it actually affects you, My poor student, I mean...
What a trial.
What an experience for her that was, But she done amazing.
So those are some of the low points. What are the high points?
So a lot of our patients, they might come back and visit us. So it's a long rehabilitation process. They come back with their families and visit you. And it's amazing, and everybody's so happy. And actually that feeling of happiness, because, they've recovered, they look great. In fact, most of the time you don't recognise. You always recognise the family because they were poorly at the time. So they look completely different. And actually that feeling is really nice. And a lot of the nurses say, God, that's given me a real boost. And a lot of the time we'll ask, other teams that work around the hospital, oh, how's this patient doing? You need that, don't you, when you need that boost.
So it's those moments that balance those others?
Yeah, absolutely, yeah. And I think as a team, pretty close-knit team, I think because there is a lot of sadness as well, on the unit, so we obviously have to support each other. So we're very good at that. We're very good at, in the tea room, and I think a lot of us got quite good sense of humours.
Yeah.
Whether that being dark sense of humour, I'm not sure, but
I guess you need to have a good sense of humour, don't you?
Yeah.
Shall we walk this way?
Yeah.
You said there's side rooms over here.
Yeah.
Is there much of a difference, like you said, between the bay and the side rooms, or is it just...
It's just the patients are isolated down the corridor.
Have they got to have eyes on the patient at all times, sort of thing? Or?
Yeah. So basically, Meg couldn't leave her bed space and just go to the toilet.
Okay.
She's got to let the nurse know next door that she's going, and any information that you need to pass on to that nurse. Yeah.
And I can see, Meg, just tell me about what you're doing at the minute.
Just monitoring my patient hourly, looking at her saturations, her heart rate, doing her blood pressure, just making sure that she's ventilating well, if there's any problems to troubleshoot and kind of overcome them issues.
Yeah. Thank you so much for that. So tell me a little bit about your new role, because you've only just really sort of taken up this practice educator role.
Yes.
What does that entail?
There's lots of elements to practice educator role. First time that we did a boot camp, they had a couple of weeks of guest speakers coming in, talking to them about end of life, or the anaesthetists will come and teach them how to use a ventilator.
Yeah.
One of our doctors done a session on cardiac rhythms.
Okay.
So they had a wide variety.
Broad.
We done simulation days. So in Sid Watkins,
This
we
is the
used
dummy
him.
that's in the bed in the training centre.
Yeah, so we used him quite a lot. Yeah, we had a good time with that. Just sort of really making it quite real.
Yeah. And how did it go?
It was good, yeah.
Did they get
really
it?
well.
They got the benefit of that?
Yeah.
And how are they getting on?
So they're doing well. They're on the unit now, doing their shifts. They'll have some further teaching days. I think they've got a tracheostomy study day coming up, another deteriorating patient day. They're all really keen. They're a nice group of girls. They're all really lovely.
Yeah.
So we're just trying to really impart our years of knowledge onto them.
Yeah.
And make them the best practitioners that they can be.
Yeah. And is that essentially what practice education is?
It's also, we've got to look after our existing staff as well.
Okay.
Make sure that all their competencies are all up to date. Facilitating if we've got new equipment coming in.
Sounds like it's quite a slightly different
It's very
way
different.
of nursing.
It's very different for me. Yeah. I'm also doing, an electronic observation?
Yeah. Oh, yes.
So at the moment we've got paper observation charts. So we're all going electronic. It'll draw all the information from our monitors into the computer.
Into
so,
one.
Yeah. So
Wow.
all our forms, all our charts, and everything will be in one computer.
That'll be
So
quite good.
Yeah.
Yeah.
It helps improve, patient care and safety. So at the moment, the system's getting configured. So Holly, one of our nurses here, so she's configuring, coding these charts, because what we've got on paper has to go on to the computer.
Yeah.
And then a couple of our doctors as well are involved. There's a few people involved.
Well, it has to be easy to use.
Yeah, so it's
simple
good,
to understand.
Of course, yeah. So then I come along and I review them. So I'm review the forms and see if there's any spelling mistakes or could it be done better.
Shall we go and sit somewhere and have a chat about you?
Yeah. Am I right to go in here for a minute?
How did you get into nursing then? How did you get into being here for 18 years?
I was probably quite late coming into nursing. So I've got 3 children. So when my youngest was 2, I was a florist before that, believe it or not.
Oh, lovely.
Yeah. My parents had a flower shop. I always wanted to be a nurse, but I thought, maybe I'm not. I've got 3 children and Jessica was 2. I thought, I'm not going back to floristry. So I got myself a job in a nursing home.
Okay.
And I thought, I'll do my MVQ level 3. I ended up being there for 2 years, believe it or not. I was doing my MVQ level 3, and then they turned around and said that they weren't registered or the registration ran out. And I thought, I'm going to be here forever. Got home, went on the computer, and I decided, right, I'm going to do an Access to University course. So I went to Southport for a year then, got on the Access to University course, and then I went to Edge Hill Uni for 3 years. And then I'd done a couple of placements in the Walton Centre. So my first one was Dot Ward. And I'd done NRU, which is in your rehab unit
Oh,
then.
yes, yeah.
CRU now. I ended up doing a placement here.
And what was that like?
It was completely terrifying. I remember walking in thinking, oh my God, it looked like cockpit of an aeroplane. There were so many pumps. I thought, I'll never be able to do this job. So I think I'd done a 12-week placement or something. And I think I ended up coming back on another placement, the one my management placement before. Anyway, a job came up and then I applied for the job and ended up,
So even though you came and you did a 12-week and you thought, this is terrifying, what am I going to do?
Still push.
You saw the job and thought, I'll have that. Why was that?
I think because when I looked around and the nurses were amazing and they gave amazing care, that stole it for me. I think you can give your all to that one patient, even though it can be very busy at times, even though there might be a lot going on to look after. All the patients on this unit get really good care, good quality care, and the team are amazing as well. I thought, what, if they can do it, then, I'll persevere and I can do it as well. So I did persevere, and here I am.
You said about digitising patient observation charts, and where do you think that bit's going in terms of almost like digital nursing? Where's it headed and what do you think of that?
It's good because at the moment we've got some digital, so when we do our writing up, it's online, and then some of it's in a file. If it's all online and it's giving you prompts as well, then it's going to hopefully improve patient safety. Everything's all on one system is going to be so much better.
So aside from work, how do you relax?
So I've got a gorgeous little dog called Mabel, little border terrier, so full of energy, take her on lots of walks. I'm also a member of a gym because outside, my mother and father-in-law are 92 and 93, still living at home. Gosh. So we're doing a lot for them, an awful lot for them. It's hard to sort of switch off as well sometimes, even when you think, do I really want to go to the gym? When I force myself to go, I feel so much better when I come out.
And looking back, what do you think for taking that leap?
Sometimes I think if I look back, I thought, oh God, I can't believe I, put myself through that. But actually, I feel quite proud of myself, actually. So it was quite hard work, 3 children. I was up like 3 o'clock in the morning doing assignments. It was hard. Obviously my husband helped a lot, but come home from placement and you'd be making 5-pack lunches, crying over the you'd be crying over the bread, buttering it, I just want to go to bed, yeah. So it was hard, but if you want to achieve something, and if you want something that much, then you put yourself through these things, don't you? Had a goal.
Was it worth it?
Oh yeah, definitely. It is a lovely place to work. I mean, obviously there's times where, it's very sad and challenging, but you dust yourself off and then you get yourself back into work.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.